Restoknee. No replacement. Save natural knees.
I'll just show you a couple of screens. So I'm just going to talk about a simple and novel method of gait analysis after knee preservation surgery. So what exactly I want to bring about is a new tool by which you can go for the gait analysis. So I'm very much thankful to Dr. Dinesh Chakkar who has given me this opportunity. So basically gait has come in BC 1500, which is a horse. From the horse it has come, like you can gait a horse. So it's a manner of walking, and we can say also it's a horse way of moving. So where the gait is in our day-to-day life, it is in the child learning walk, then the normal learning, then identifying a person, he is walking or she is walking, medical diseases, sports teachings, acting, mimicry, forensic science, which has come up very much now. People, police can find out the thief very well with the gait. Fashion show, and also there is an application in animation, film, robotics, and avatar in metaverse where the gait is very important. So what I'm going to cover about is importance and aims of this gait analysis review, labs, and about gait sense. Gait sense is the tool which is given a name, then the study material, observation, literature, search, and summary. So the importance of gait, we know it identify unique movements, define normal gait patterns, diagnose issues which are causing pain, the source of the pain, then plan the treatment, correct deformity, find out the results, and by which you do more and more gait analysis and you develop better and better methods. So the normal gait cycle, which we all know, we just recapitulate, it is from the heel strike to the deceleration with a stance and swing, and there is a strike. So with this normal understanding, how many abnormal gaits we are coming across? There are so many. But interest for us for the osteoarthritis of knee or preservation is an antalgic gait, which is a painful limb where the stance phase is less than swing phase. Very simple way to understand this. So gait analysis labs are many. So many have come up in the world with a very costly, very complex, and very sophisticated gadgets where gait analysis is going on. So now what I'm going to talk about is a very simple tool where it can be done. So this is a publication which says that there are so many methods, but basically a body sensors method is a better than all other methods. So existing, what are the solution? As we have already learned from the morning that it can be just a 2D sort of a picture where you can find out what could be the weight bearing and changes. And then when we have an optical tracking and 2D, 3D different methodology with the cameras and other things. And now recently it has come up with an IITV where patient walks on that particular floor and IITV pictures are taken, which is under the research. So what is this particular tool is a called Gait Sense. It is a product from the Synersence, and it is having 6 sensors with one master which is recorded in a laptop and a software which is called Move Axon. So this is a device which is basically a wireless Bluetooth technology. There are multiple sensors connected to the master nodes, and there is up to 360 samples per second can be taken up from the patient's gait, and 3D motion animation can be done with this with the dynamic data with this software, and it is certified by all the government regulatories. So this is a portable, accurate, affordable, and having a digital report. So it is very simple, and there are so many publications which are on this. This particular software is very good to understand or to learn or to teach or to counsel the patient regarding what is the gait problem and how it's going to be helpful when we do. So what is the study material? Study material is from the Restoknee Hospital, where pioneer inventor late Dr. Sharad Oza, thereafter Dr. J.J. Patwa, and I have joined. where there are more than 1,000 such high table osteotomies done with around more than 300 now we are having a good data, and there are publications. So basically it is 21 cases which has been included in this study, all operated by same method at Restoknee Hospital, and follow-up was up to 6 months. So gait analysis was done by Gait Sense, that is the tool. So what exactly is done, that as usual with the other methodology, X-ray, CT scan, 3D model printing, and measurements, follow-up, CT, everything is done. But it's basically a closed wedge, no implant, next day weight bearing with a tailored brace. That type of osteotomy is followed. But there is a pre-operative, we go with the pre-operative CT and MRI. We send the data to USA to Curious Data Science. They give us all the feedback and they tell us what is the best wedge to be removed. The closed wedge osteotomy with the transverse incision is done. And then postoperatively, a tailor-made brace is given for a month where patient is weight bearing and thereafter a short brace. So with this methodology, we try to find out kinematic, which is a study of motion, static, which is a study of the forces of stationary objects, and the dynamic, which is study forces of the moving bodies. So what happens when we learn about the kinematic motions? So there are different planes where you can see sagittal, coronal, and axial view, where you can find out what is happening pre and post to the operative osteotomy. These 3D sensors, they are put on the body in a supine position, I mean, on the forefoot side, one just upper part of the leg and one in the mid thigh. And this is the engineer, Mr. Gunjan Patel, who is MS IIT Madras Eye Fellow, who is doing all this work and is a wonderful person who's giving us so many better and good idea with a precise sort of a statistics out of this particular tool. So we have tried to learn the FFD supine, FFD in standing, varus, walking movements, walking rotations, and spatiotemporal parameters. So this is the case one where you can see that learning from this sensor, we can find out there is a 55% of improvement in FFD. These are all kinematic study. They are not the X-ray pictures. Like standing, in varus, there is a 56% of improvement. Then another case where you can see the FFD has improved by 40%. Another one, which is the virus has been improved by 42%. All these things are from the gait analysis, not from the X-rays. And this is a case where both combined, the results are that is 25% and 24% improvement, which is sensed by this particular tool. So regarding FFD with virus, what is happening? The p-value is so good that it allows us, or rather it promotes us to do better and better studies, because now we are getting very good parameters by which we know that if we go ahead with this type of a study, we'll be able to know more about the effects after doing upper tibial osteotomy. And this is a complex one, but what exactly it says about the rotation is that the knee flexion increases post-operatively. And so when you do correction of these axes, the knee flexion is also improved. It's a very complicated thing, which I also took very long time to understand all this. And in the gait swing, mid-swing flexion, that also increases very well once the load goes more on the healthy side, that is on the lateral side. So surprising part is that even if the operated joint is better, even the non-operated joint also shows some improvement, because the operated joint is now able to bear more and more weight, which is less painful than before. So this is a chart of the supine sagittal flexion deformity, which has been corrected. Again, p-value is less than 0.04. So it is significant with all 21 samples of the different patients. And it is regarding the rotations, where all these things which has been seen, where the rotation range is dramatically changed after operative osteotomy results. In the spatiotemporal part is very interesting that walking speed is improved by 13%, cadence, the steps per minute, improved by 14%, and stride time, which is improved by 13%. So all these parameters gives us a good idea. So when we go to the literature, like this particular paper says walking speed and strength increase and the knee abduction movements and lateral thrust decrease. This paper says that there is no change in the time distance parameter, but the patient feels very good. That is how they improve the gait. This paper says like, all about the gait analysis, that the open wedge reduces knee varus movement and lateral surge, but the closed wedge lateral surge is not very well improved. And this paper says that STO surgery restored frontal and transverse plane knee loading to normal levels. And that is something which is very much significant. These papers, which says about valgus open with STO, produces significant internal rotation of the distal tibia. This is another significant part which has been very well documented. And this is a study where there is a substantial and clinically important changes in the dynamics. So is there a load change really occurring or not, which can we see by asking the patient to walk and taking all these data. So in summary, this gait analysis by a gait sense is a simple and a novel method. It is wireless, portable, and accurate. It produces varieties of digital recordings and analysis, which for the future, all researchers can use it. And gait analysis by the closed wedge STO, which has been in the study part, is comparable with the analysis done by other methods, tools published in the literature. And future technological modifications and additions of the parameters may establish this method as the most preferred and standard analytical tool. So this is what I just want to say. And to the lighter part, all this type of gait, people are also using the same things at the Ministry of Silly Walking, where the actors can also make you give some entertainment by showing different gaits. So this is also as a part of an importance or interest of the people about the gait. So I thank you very much for this patient listening and giving me this opportunity to talk about gait. Thank you.